The fifth area of specialization here at Harmony Place is dealing with sexual issues. And that may be sexually related trauma, it may be issues around sexual performance, issues around both physical and emotional intimacy. Sexual issues usually are co-occurring problems with pretty much any other presenting issue, whether it's a mental health issue or it's an addiction issue or an eating disorder or in particular trauma. Usually there's going to be some kind of challenge with physical and emotional intimacy. And I think we're uniquely trained to address those issues as well.
At Harmony Place, the treatment of sexual difficulties is broad. We treat sexual dysfunction and sexual disorders because hyposexuality, too little, and hypersexuality are oftentimes two sides of the same coin. And they're both really about intimacy disorder. And what I mean by that is that people get focused on sex, but sex and love are intertwined. And so people who are hypersexual are really looking for someone to love them. And what they do is they rush in order to be able to find someone to love them in sometimes strange sort of ways. And then once they get in there, they get scared and they have to distance themselves. So the way they distance themselves is by having affairs, the way they distance themselves is with pornography, the way they distance themselves is by dressing in women's clothes, whatever it is. These interferences are all about not wanting to get too close. And if you look, it's almost always due to someone in the past has hurt them. So their mother was schizophrenic and tried to kill herself. And so when they reach adulthood and they find a partner, what they want to do is they want to get close, but they want to keep distance at the same time. So, you have to stabilize the out of control behavior, but then you have to look underneath it and look at what it is that amplifies it and maintains it over a period of time. So the truth is that it seems like getting under control will be relatively simple, and it is temporarily, but the truth be told is it's almost as hard as treating eating disorders, which is that behind a sexual addiction is not just abstinence. I mean, you can't abstain from sex, and anymore you can abstain from love, but it's allowing the person to begin to establish a real healthy relationship with other human beings. And that's what it's all about. So yes, getting under control and stabilizing the behavior you can do in a oftentimes brief residential kind of program. But the real recovery comes from looking at the intimacy disorder, the attachment problems underneath it, and working with that in some ways. And that's what we do at Harmony Place. We really help go depth and look at the deeper issues. The vast majority of people that I've seen have been in treatment for years with local practitioners, and they come oftentimes from long distances because what they've done has been necessary but not sufficient. And they're relapsing, or they're still looking at pornography, or they're doing something to distance themselves, or they're kind of addicted to 12-step programs. They go to meetings for the last 10 years, and that helps them maintain control. And, but they still have this underlying intimacy problems. So to me, it's kind of a tragedy because they're giving up their out-of-control sexual behavior, but they haven't substituted real love and intimacy with another human being. So you're sort of sentencing them to aloneness, with the exception of their 12-step meetings, which is their only connections with other people that are meaningful. And that's useful, but that should always be temporary. You should be able to go from your 12-step community to real relationships with real human beings, and ultimately to love and be loved in a complete sort of way. And that's really what recovery is mostly about.